So let's take a look at the new assessment for a Child Protective Services investigation, the way the assessment is organized and the information contained inside the new assessment. When you come to the new assessment page in your TWIS documentation, the first thing you're going to find when you arrive at the new assessment landing page is the assessment of the child youth and the different things that we're asking folks to capture when they're doing an assessment of child youth. Now, what you'll note is that this is going away from the way the current assessment is organized. Currently, when you arrive on scene to the new assessment, you have the maltreatment section. But what we know is the first piece of work that the worker does is the work of interviewing the child and youth. So we thought from a translation perspective, it would be much easier just to build this worksheet, to build this documentation tool, the way that you actually do the work in real life. So the child youth section is organized in several different categories, just like the things that we're currently asking you to assess in the child youth section of the CQA. The first section is the child physical and mental health. And this is organized, as I mentioned earlier, in a way that would have in one column the risk factors that are present for the child, the things that make the child vulnerable, and on the other side we're calling those protective factors, so the things that allow the child to protect themselves or that would result in them not being as vulnerable when you're assessing their development. So for example, in the physical mental health, you have things like in the risk factor side, physical disability, a hearing or vision impaired child, a medical diagnosis, and we tried to split that out because there's such a continuum of medical diagnoses. We wanted to make sure that we have life-sustaining as an option. We also have requiring ongoing care as an option. So you may have something where a child has a G-tube or has a trach or something along those lines. That would be more life-sustaining, something that they need to be able to function every day. And then something requiring ongoing care might be diabetes or medication, psychotropic medication, or other medications that they need to function. We do have psychotropic medications as an option that you would be able to document there. We have a mental health diagnosis that requires ongoing medications. And then we've got things that are just medical issues, like if the child has a current broken arm when you come on the investigation, or if they have severe allergies or asthma, things that you would note that would require care and again increase their vulnerability if they have a caretaker that doesn't know how to meet their needs or provide them the ongoing care that's required. We have captured here a history of seizures. For those of you that have been around forever and a day, we've been asking you to document whether or not individuals have seizures, and so now you have a place to check that box, and it's real obvious that you've asked the question, you've done the assessment on that piece, and it's captured. Over on the protective factors side, the variables that you have to choose from there are that the child youth has no physical or mental health issues, that they receive care for those, that they receive care for mental health, and we split that out, mental health and medical issues. And then we also included that they were up to date on immunizations. As we were reading through the body of assessments that are currently out there, that's one of the things that folks routinely assess for, and that's important to know, especially in the younger kids. That gives you kind of a clue about the parental care and supervision of the child if the child's up to date on their immunizations. So that's pretty much the basic factors that go into the variables for physical mental health. The next category is child development and education. This is where you're going to document things that the child is educationally delayed. They have an IEP. They require assistance for dressing and bathing. They have poor social skills or peer relations, difficulty communicating their needs, non-mobile or limited mobility, and that might be a no-brainer when you're investigating or assessing a youth that's a baby, a 6-month-old. But we also wanted to give you the flexibility if, sometimes you have a 17-year-old who might be a CP child that is a quadriplegic, or you might have a non-mobile 12-year-old. So we wanted to give that flexibility in there so that you had the opportunity to document that without having to think about that and rate that for yourself. We also included in there's a lack of muscle control or motor skills, that they're not attached to the adult caregiver, and we lumped that adult caregiver attachment into this development because you guys know and recall from all your training that you've had on attachment that will impact directly the way the child develops and kind of their prognosis long-term. Attachment has huge significant impact for children in their development, so we wanted to capture that there. And then we also have, if none of those things are present, in all these categories, we give you the option of saying that there are no risk factors present for that specific category. And that was directly at the request of the field staff when they tested this particular paper assessment to ensure that it met the needs during the course of an investigation. On the protective factor side, you have things like able to dress or bathe themselves, secure attachment to the adult caregiver, good social skills, the child receives services for any delays they may have. And I want to emphasize there that just because a child has a delay, that doesn't necessarily mean they're vulnerable unless they're not receiving services or support and care that they need. So we wanted to make sure that you had that opportunity to identify, yes, they have a delay, but they are also receiving services for that helps get them and keep them on track. We also split out specifically that they're educationally on track and they're developmentally on track. We do a lot of training in the academy, and you guys, I'm sure, reinforce that as the supervisors and the regional staff as you're working with your staff to ensure that folks are looking at that when they're doing an assessment. Is the child educationally and developmentally on track? That speaks significant volumes to their vulnerability, so we wanted to include that. The next section that you've got for the child youth section is the child behaviors. We wanted to tease this off and look at this specifically because what we know is, and for any of you all that are parents, you have one child and they present this one way and they may be loving and snuggly and whatever, and you have another child that's not like that at all, and you even wonder, how did I, as a mom with this dad, end up with these kids that are so significantly different? So we wanted to pull out behaviors. We looked at the child behavior checklist because that's something that you'll be doing for leveling, so we wanted to include some of those variables to make that the ease of use for that. But we also wanted to kind of identify when you're looking at a child with a lot of behaviors, that's going to automatically up your red flags for, can this particular caregiver that I'm dealing with handle these particular behaviors that these children are exhibiting? That's going to be a real key in your assessment when you're thinking about risk of future maltreatment and existing maltreatment. So we've got things on a continuum, and we tried to do these most egregious to the least egregious. Tried to look at things that were the most severe down to things that needed to be managed but perhaps weren't as severe or difficult to manage. So you've got things like torturing or killing animals. Obviously, that's a red flag for behaviors. Fire setting, destruction of property, gang involvement, alcohol use or abuse, drug use or abuse. And again, we're talking about children, under the age of 18, so all of those activities, the drugs or alcohol, are both illegal. So keep that in mind as you're thinking through that. Expulsion or suspension from school, which would be a flag to folks that they're having some behaviors at school. Truancy, escalating negative behaviors. We also included a variable which I've seen discussed a lot in CQAs, but I haven't really seen anybody talk about the impact of this, and it's that a child would require extensive supervision. A lot of the times you have kids that are escape artists and they can get out, and the parents have put locks all the way up the door, and they're still figuring out a way to escape. And so, it's not that's a bad thing for the child, it's just that's going to give you some insight into how to plan for future risk assessment with the parent. How do we make sure that we keep this particular child with its current escape artist tendencies safe in this environment? We've got doesn't follow the rules and can't focus. Those might seem benign to you as an investigator or an assessor, but again, what you know about those behaviors is that's going to require extra on the caregiver's part. If you've got a child that's hyper, that child might tend to frustrate their caregiver a little bit more. If you've got a child that doesn't follow the rules, that could get into some control battles. That could result in neglect, but it also could result in physical abuse from a frustrated caregiver. So we want to isolate those variables and ensure that folks are taking a look at those and understanding the impact that those sorts of behaviors have on a caregiver-child relationship and interaction. We have rages/tantrums. The reason that we included that is I can't tell you the number of times that I've read a CQA and in the discipline section, the parent might say that they use timeout. But in 3 or 4 statements in, they talk about how the child rages and tantrums and bangs their head. I, as an investigator, would want to make sure I understand when that stuff is happening, how do you keep the child safe? And how do you manage that without getting frustrated from your own skill set? If they're doing property damage through this rage or tantrum, how do you manage that? And how does your other adults living in your home or that have to manage this child on various and sundry occasions, how do they manage that? We have encapresis and enuresis, which is not being able to hold your bowels or bladder. Those are fancy terms, but we wanted to make sure we use the correct medical term. So just for, those aren't things that I was familiar with until the medical people informed me what they mean. But we included that not due to age. So let's say you've got a 12-year-old who is all of a sudden wetting the bed, or we've got a 6-year-old who was previously potty trained, but now all of a sudden the school's reporting that they're soiling themselves at school during the day. That in and of itself should be taken in context of all the other things that are going on. If you do have those sorts of issues, what we obviously recommend is that you seek some guidance from a medical professional to help us understand what's the origin of that and help the parent, again, when you're planning with them, cope with these sorts of things. Every single day for a week, if the child's all of a sudden soiling themselves, that can result in some frustration for a caregiver. And so that would be a conversation that you'd want to have. How are you managing that? And what are you doing to keep yourself calm and to move forward? What we know about sex abuse investigations, physical abuse investigations, and all child protective services work we do is that sometimes those things are the result of abuse or neglect. So that's in there. That doesn't automatically mean that's what we're not making that connection automatically, but we need folks to explore that to see what that's about. We've got bullying in here. We found a lot of things that we wanted to flag as when kids are all of a sudden, or if they're not all of a sudden, but if they tend to bully to get their way or to manipulate others, again, that can result in some oppositional stuff that goes on with the caregiver. You might want to look into what's going on with that. And that's not just for little kids, obviously, that's certainly in the middle school to high school kids, what's going on behind the scenes on that. We have threatens to harm themselves or others, has harmed themselves or others, sexually reactive or sexually active, previous juvenile court involvement, and we wanted a place to document that this is a child who perhaps has been interfacing with the court system already to kind of look at what's going on with that situation. They were a past victim of abuse or neglect. That's really critical. If you're doing an investigation where you've got a child that is presenting with certain behavioral features, you'll want to make sure that you understand all the trauma that the child has been exposed to and had to face before you arrived on scene for this current investigation. And then obviously we have a no risk factors present. On the protective factors side, we have just 3 pieces. The child receives services for identified behavioral indicators. The behavioral indicators are within the normal range for the child's development. All of you all again that have parents or anybody that's done this work for very long knows that even our little angels that we have, my child included in that, had days where they were just really difficult to deal with. What we're really looking at, that those are within the normal range for child behaviors. I remember my mother saying that I was a really big smart mouth when I was in middle school, right, in high school. So while that was unattractive for her to deal with, that was in the normal range of the other girls that were in my class. And then last, for the protective factors, is that the child is responding to the services provided. Again, we want to make sure that we're emphasizing, you might have identified these variables over in the risk factors category, but if there are services in place to offset those, you want to take that into consideration. Again, you're trying to get a picture, a clear picture of the vulnerability of the child. What particular behaviors, development, physical and mental health puts this child in a vulnerable category, and if they are vulnerable, are they receiving any services to lessen that or to help them adapt and cope? So once you get through with those major categories and you've identified using our checkboxes what variables and factors that you found during your assessment, what we want you to do is just describe anything after that that would need further description. So for example, let's go back to encapresis or enuresis. If you have checked that box, what we're really looking for down in the description box is for you to talk about that a little bit. The child was potty trained, and now all of a sudden 2 weeks ago they started soiling themselves or they started wetting the bed. That's going to help give a context for the child and the behaviors that you, or the indicators that you checked, that you identified. This is also where you would want to lead in with a description of the child. So when I'm reading these, after you all start doing this, what I hope to see in this section is Amelia is a 4-year-old Caucasian female. She goes to Happy Days preschool. She lives in a home with 3 other siblings. And then that gives me a little bit about her. You've identified all of these other behaviors, development, education, all these other factors. If there are things that the reader would need to know to understand who is this child and what is their vulnerability, you'd want to fill those in right there. So we've given you an opportunity to check things that you've observed and identified, and then we're giving you a kind of an open text field so you can describe the child that you're observing.